People often say ignorance is a bliss. But when it comes to finding your first job as a doctor, ignorance of essential requirements of experience and qualification is not a bliss. It will waste time, it will waste resources, and it will frustrate you. As a junior doctor, if you don't have an internship, you're not going to go anywhere and you're not going to find your first job. It'll be very, very hard. As a GP, if you don't have the specialist GP exam and if you don't have the right level of years worth of experience as a GP, again going to struggle, waste a lot of time. As a specialist, I've seen the people who have had their applications denied because specifically they lacked a certain laparoscopic skills, outpatient skills, the communication and teaching presentations, the publications, the specific details in terms of consultant level clinical governance, quality improvement things. We may ignore them because we are ignorant, but these little things which are ignored are going to be detrimental for your future in any country if you want to progress. In 2022 to 2023 financial year, a record-breaking 8,356 new doctors registered to practice here in Australia. But that record did not last long. In 2023 and 2024 financial year, the bar was raised even higher, with 9,490 doctors entering the workforce, the largest influx in over 10 years. One of the biggest drivers behind this boom is the influx of international qualified doctors. The last financial year alone, 5,431 overseas trained doctors registered to practice here, a staggering 80% increase compared to the 2,991 doctors who registered to become doctors in 2018 to 2019 before the COVID-19 pandemic. Things have really moved far. There are still doctors not been able to get the jobs. In order to address the issue, I have reversed the table slightly. In the past, I have numerous videos what you need to do to secure your first job in Australia, whether you're a GP or a junior doctor or a specialist. So in this video, I'll focus on what must you not lack. If you're missing these critical elements, your chances of building a successful medical career or any career for that matter in Australia or any other Western countries are next to nothing. But these are my personal opinion based on my hundreds of interactions with junior medical officers, GPs and specialists. For clarity, I've broken down the discussion into the following key areas: lack of experience, full of career gaps, lack of training, lack of courses, lack of postgraduate exams back home in your own country, lack of proper documents, English language proficiency. Now let's talk about lack of experience. It's commonly understood that every job requires a certain level of experience. For junior doctor, you must have an MBBS and a 12-month internship. Many graduates from countries like Russia or China who are primarily a citizen of another country like Pakistan or India or Bangladesh lack this internship experience, hoping to complete it in Australia instead. Yes, it's technically possible to do so, but in Australia, the positions are extremely limited. And also these positions often go to the candidates who have some residency experience. Now I'm talking about the overseas doctors, and the gaps are due to valid reasons, for example, maternity leave, and they've already completed the other things like AMC clinical exam. Competing without an internship against such candidates is nearly next to impossible. And if you lack even the basic internship experience, you don't stand a chance, I'm sorry. For GPs and postgraduate qualifications like MRCGP or equivalent specialist level exam, and there's a list of those specialist level exam from Sweden, from different European countries, from US, from UK, and need to complete that in addition to the clinical experience. Without such qualification, you'll have to take a standard pathway which involves doing the AMC exams and starting the GP training from scratch. Indeed, a long and challenging process, especially for someone who's established GP working back home in their own country. Now, the different doctors who ask me that I've completed MD in internal medicine, or I've done FCPS in general medicine, or FCPS in gastroenterology, but I want to become a GP. No, not in Australia. In Australia, GP is actually considered a specialization of their own. They've got their own college, they've got their own training program, and the only way to practice general practice in Australia is to have some sort of GP experience and GP exam qualification back home. You cannot have a lateral entry through your own specialist experience in general medicine or general surgery for that matter. So please make that thing very clear that you have to have a special skill set for a GP entrance. Now, for specialists, a lack of experience is even more detrimental. Now, I'm talking the specialist application. Australian specialist training program are generally longer, 5 to 7 years, most of them. Now, compared to those in many other countries, like in India, the MD programs are 3 years, MS programs are 3 years, FCPS programs in Pakistan are 4 years. So you may have to compensate for these deficiencies with your senior resident or consultant level experience, but only if it's well documented with logbooks, CBT activities, procedural records, and without these, your application will just not work. It will not succeed. And I've seen plenty of those examples in which the people were successful when they were able to match those minimum criteria of that of an Australian trained physician or a surgeon with their FCPS and MD and MS program. And we've got plenty of successful application to prove that. But people who were not able to do that were not able to get a successful outcome. And I'm sorry to say that this is how things are organized. You need to have set number of laparoscopic procedures, set number of arthroscopies, set number of laparoscopies. It's just crucial, and it's all available out there in the standard curriculum definitions on your specialty colleges. Career gaps. A career gap is any period where you're not actively involved in a clinical work or a direct patient care. It's as simple as that. There is no way to compensate the lack of direct patient care. Now, common reasons like studying for exams, maternity leave, well, these are all valid reasons. They do not actually compensate for absence of hands-on patient care. Now, hospitals and the people who are shortlisting CVs for a job interview view gaps longer than 3 months very, very unfavorably. Now, to mitigate this, you must fill these gaps with only clinical experience. When I say clinical experience, direct patient contact and interaction. Whether paid or not paid, it does not really matter. People do go back overseas and do the recency of clinical experience in various hospitals. That's fine, as long as there is some form of patient interaction. You're taking a history, examining the patient, you're under supervision in terms of discussing the management plan. Now, observerships, CPD activities, teaching, courses, non-clinical roles all sound great, but they are not going to compensate for your clinical career gap. The only thing which compensates, as I said, is direct patient interaction. Now, training is absolutely vital. Whether you're in a private hospital or a public hospital or a clinic, you need to have a documented evidence of working under senior doctor supervision who have directly overseen and critique on your clinical procedural skills or diagnostic skills, your communication skills. This does not mean that you need to be in a training program. In fact, in Australia, the first 3 years are called pre-vocational training, during which all doctors after the internship are rotated through medicine, surgery, emergency medicine, GP, psychiatry, or even doctors who want to join surgical training or radiology or psychiatry do the same rotations, as this is perhaps the most, important time of your professional medical career to diversify your experience. After that, you'll be in specialist training and you'll almost certainly not get that holistic journalist experience. So this is absolutely important that you get some form of supervised training in your country. Now, I ideally say 12 to 24 months, but then again, it ranges differently from different specialties. So when in your home country, try choose hospital that have good degree of supervision from your seniors. There's an active environment or culture of learning and teaching opportunities. If you look at any job advert, be it for JMO, be it for GP, even specialists, basic life support, advanced cardiac life support, and sometimes even advanced pediatric life support are absolutely mandatory. There are certain other courses like procedural skills courses, and these are absolutely minimum requirement because these are safety requirement for most junior doctors. GPs and specialists need to have these requirements fulfilled before being able to apply for jobs or considered for shortlisting for these jobs here in Australia. Now, if you haven't completed these courses, it shows that you lack readiness to handle emergencies, which is a crucial, essential criteria. Enroll and complete these courses from any institute. It does not really matter if it's an American Heart or if it's a local course. As soon as you've got a certificate to prove that you've got a proficiency and understanding of handling emergencies, it's good as gold. After complete your internship, passing the postgraduate exam of your own country, like FCPS Part 1, MD Part 1, is highly recommended. Now, you may question me, why is that? Because you're coming for the very same reason to Australia. That's completely fine. I call them, or these exams, foundational exam, because these exams demonstrate a strong foundation in basic clinical sciences, often better aligned with the international standards than you may realize. Because when I'm doing these specialist examination for specialist surgeons and gynecologists and even GPs, I do see that these exams are given quite a bit of value. And I must say, the primary exams of FCPS Part 1 and primary exams of MD and MS are absolutely in line with that of an Australian exams. That is a primary level surgical and physician exam. Now I'm still seeing CVs with personal photographs, 3 columns of information on the first page with absolutely jumbled up streams of inflow of information. Trust me, they're all going to go to bin. I often say that if you're not getting shortlisted within 8 weeks, you need your CV to be redone. Don't underestimate the importance of this very, very important step. I've seen plenty of good people with excellent credentials, but who are absolutely a fail when it comes to their documentation of CV and application form selection criteria. English language proficiency. Now, passing an English test is important. You know that IELTS, which is academic, OET and PT, is mandatory for all pathways: standard pathway, GP pathway, specialist pathway. So make sure that you meet the minimum standard criteria which are announced on APRA website. There are no shortcuts to success. Lacking experience, training, essential courses, or proper documentation will hinder your career progression. If you are unsure about where you stand, or you feel that you might have deficiencies in any of these areas, don't hesitate to reach out. At Emergency Focus, you can email us for one-on-one consultation or any advice via the email, which is completely free of cost, info@emergencyfocus.net. Take care of yourself and each other. Goodbye.